Have you ever wondered why there's a deep-seated mistrust among Black people towards the healthcare system? A question that pulls us back into the shadows of the past, hinting at the Tuskegee Experiment. An unspoken narrative of deceit and manipulation, a tale of unethical medical practices that left a community scarred and skeptical. A story that fuels the flame of mistrust even today. An unsettling question indeed, yet one that we need to confront. Today we unravel a dark chapter in history and its lasting impact. The Tuskegee Experiment, a study cloaked in deceit and unethical practices, was conducted between 1932 and 1972. This dark chapter of American history unfolded in Macon County, Alabama, where the United States Public Health Service embarked on a study that would last for 40 years. The objective of this study was to observe the progression of syphilis, a sexually transmitted disease, in the absence of treatment. The subjects of this study were poor African American sharecroppers, men who were neither informed of their diagnosis nor the real objectives of the study. Unaware and uninformed, these men became pawns in a game of scientific exploration that disregarded their human rights and dignity. As the years rolled on, the experiment continued, even when the cure for syphilis, penicillin, was discovered in the 1940s. Despite the availability of a cure, the subjects were never informed nor given the opportunity to receive treatment. Instead, they were left to endure the ravages of the disease, their bodies breaking down as the disease progressed unchecked. This shocking truth is a grim reminder of the depths to which institutional racism can sink, exploiting the vulnerable under the guise of scientific progress. The Tuskegee Experiment was not merely a scientific study. It was a gross violation of human rights, a betrayal that used Black men as subjects without their consent or knowledge. The result of the experiment was a catastrophic breach of trust and devastating health consequences. The experiment led to the death of many participants and the spread of syphilis to their families. It was a disaster that extended beyond the immediate victims, affecting entire families and communities. It left a lasting legacy of distrust towards the healthcare system among Black communities, a distrust that persists even today. It's a sobering reminder of the profound impact that unethical practices can have on individuals and communities alike. The Tuskegee Experiment was not just about medical research. It was a tragedy that unfolded over decades. The deception and unethical practices of the Tuskegee Experiment were like a poison, seeping into the very fabric of the Black community, altering their perception of healthcare forever. A profound wound was inflicted, one that was not merely physical, but also deeply psychological. Imagine being betrayed by those you trusted to protect your health. It's no wonder that a deep-seated distrust took root. This experiment wasn't an isolated incident. It was a stark manifestation of systemic racism, a grim reminder of the times when Black bodies were treated as experimental fodder, their lives deemed expendable. This blatant disregard for Black lives was not only inhumane, but also a glaring violation of basic human rights. While the experiment may be a thing of the past, the echoes of its impact still resonate today. The healthcare disparities faced by the Black community are not just statistics. They are a lingering legacy of this unforgivable outcome. It's a legacy that continues to fuel skepticism and fear, creating barriers to healthcare access and utilization. The Tuskegee Experiment was a stark symbol of inequality, a painful testament to the injustices suffered by the Black community at the hands of those who were supposed to heal, not harm. It was a breach of trust that was not easily mended, and its scars are still visible today. The impact of the Tuskegee Experiment has been far-reaching, affecting generations of Black people. But remember, it is through understanding our past that we can strive to shape a better, more equitable future. Before we dive in further, we have a quick request. We're passionate about sharing valuable information with you, and we hope you're finding this content as fascinating as we do. If you're enjoying this video and want to show your support, don't forget to like, comment, and subscribe to our channel. This way, you won't miss out on any future videos we post. In the aftermath of the Tuskegee Experiment, the U.S. government was forced to confront its past wrongs. The experiment was brought to an abrupt halt in 1972, a nationwide outcry that triggered a series of legislative changes and formal apologies. In 1974, the National Research Act was signed into law, establishing ethical guidelines for human experimentation. This was followed by a formal apology from President Bill Clinton in 1997, acknowledging the government's role in the Tuskegee Experiment and expressing profound regret. To address the deep-seated mistrust, the government initiated programs aimed at bridging the healthcare gap in the Black community. This included the establishment of the Office of Minority Health in 1986, dedicated to improving the health of racial and ethnic minority populations. However, despite these efforts, the scars of the past run deep. The apology and reforms, while significant, have not entirely erased the lingering distrust. The healthcare disparities among the Black community continue to persist, raising questions about the sincerity and efficacy of these initiatives. While the government has made attempts to rectify this injustice, the question remains, has enough been done? Syphilis, the disease at the heart of the Tuskegee Experiment, is still a health concern today. This sexually transmitted infection often begins as a small, painless sore, but left untreated, it can lead to serious health complications. Alarmingly, Black communities continue to experience higher rates of syphilis compared to other racial and ethnic groups. But it's not all doom and gloom. We have the knowledge and means to counteract this disease. Early detection through regular screenings is key. If caught early, syphilis can be easily treated with antibiotics. Consistent use of protection during sexual activity also plays a significant role in preventing the spread of the disease. In order to facilitate these preventive measures, accessible and equitable healthcare services are crucial. Affordable and regular checkups, community health education initiatives, and destigmatizing discussions about sexual health can all contribute to reducing the prevalence of syphilis in Black communities. Prevention and treatment of syphilis, or any disease, requires trust in the healthcare system, something the Tuskegee Experiment severely undermined. The Tuskegee Experiment left a lasting scar on the Black community's trust in healthcare. This horrific study, carried out under the guise of scientific progress, saw the lives of hundreds of African American men used as mere variables in a cruel experiment. They were deprived of their rights, their health, and ultimately, their trust in a system that should have protected them. The experiment's timeline stretched over 4 decades, from 1932 to 1972, a period that saw the denial of treatment, knowledge, and dignity to these men. The objective was to observe the progression of syphilis, a devastating disease, without offering any form of treatment, even after a cure had been found. This deceitful act not only led to needless suffering and death, but also the spread of the disease to their families. The aftermath of this unethical study rippled through the Black community, amplifying the fear and distrust towards the healthcare system. The scars left by the Tuskegee Experiment are not just physical, but psychological and societal. They brought to light the systemic racism and inequalities that plagued and continue to plague our healthcare system. In response to this dark chapter, the U.S. government issued official apologies and initiated efforts to rectify past wrongs. However, the efficacy and sincerity of these initiatives remain under scrutiny. True healing requires not just words, but tangible actions that demonstrate a commitment to equitable healthcare. Syphilis, the disease at the heart of the Tuskegee Experiment, is still prevalent, particularly within Black communities. It's crucial that we take actionable steps for its prevention and treatment, emphasizing the importance of accessible and trustworthy healthcare for all. In recapping these key points, we should not only remember the victims of the Tuskegee Experiment, but also use their stories as a catalyst for change. Each one of us has a role to play in advocating for a healthcare system that is fair, compassionate, and respectful to all, regardless of race or socioeconomic status. We must remember the Tuskegee Experiment as a stark reminder of the importance of ethical practices in healthcare. And as we move forward, let's strive for a healthcare system that values every life equally. We encourage you to subscribe to our channel for more insightful content like this. And while you're at it, hit the notification bell so you never miss out on our latest uploads.